like the video because it's very important to the algorithm that you hit that little plus or thumbs up, and that you share the video with as many people as you feel is necessary, because even family members who need to understand what you're getting yourself into might be interested in the information, right? And you never have too much information. In fact, I think the challenge for us is managing the volume of information. Okay, so this video is going to help you sift through a lot of that stuff. All right. And also don't forget to subscribe. I'm not going to sit here and beg you to subscribe. And I saw this lady say, ask anybody you know to subscribe. The person will cut your grass. And I'm like, okay, that sounds a little desperate. So I'm not going to ask you that. If you like my content, you will subscribe because you want to hear more. And my channel is very diverse. I do a cooking show. Now I'm doing an exercise challenge. I like to do multiple things. I'm a multitasker. All right, let's get going because there is a lot to go through. Healthcare is a conundrum, could be for a lot of us. When I was younger, I didn't think twice about getting my employer sponsored insurance because it was so cheap. The younger you are, the easier for you to get health insurance. You know that, even in the States. But as you start getting older and you start having things develop in terms of from your health status, you have diabetes, you have hypertension, you're dealing with obesity, and you have lung issues, you smoke, and all that kind of stuff, the prices kept going up. And of course, the healthcare system in the US, if you watch some of my videos, I kind of explain to you that it's not all that it's cracked up to be. They talk about all the bells and whistles, but it is the most expensive in the world, especially among industrialized countries. But our outcomes are really in the toilet. They're not that good. Meaning the US doesn't manage chronic illnesses. The US doesn't do a good job with prevention. And the US has a lot of differences in terms of, inequity, which means depending on where you live, what you look like, your access to healthcare, being involved in research. So you need to know what you have before you can compare it with what you may want. When you are a woman or man of a certain age and you're moving to a new country, it's not just the language and the culture that you need to be very familiar with and aware so that you're not shocked if you see certain things. We talk about, I do a funny video about 9 things you might not like about Panama. They're kind of funny, but those are things that you need to know, right? But when it comes to healthcare, knowing what, again, if you talk about where am I going to live, what is the food like, what is people ask about the music scene, people interested in dating, they ask us questions. But one of the major concerns that you as an older person should have is, what is healthcare access like? Will I have access to good quality healthcare? That should be on the top of your list because of your age and also because of your medical situation. If you are somebody with multiple health issues, you have a long list of things that have happened to you in the past medically. You have undergone multiple surgeries. You've had cancer. You have some chronic diseases that you have really a little bit of a hard time managing, right? You're in the hospital, in and out, in and out. Sis, I say that with so much love. You have to really think hard about relocating to another country because it's like you're going to start all over again. And when we are in our 70s and 80s, I'm not saying it's impossible, but it is kind of hard to start over when you have a laundry list of concerns, right? So there is a gentleman here called Mike Kelly. He used to have a company where he used to always say, before you come, just have a consultation with our physician. Tell them your list of conditions. Tell him your medication. And then because the physicians here in Panama are really well versed in the country and access and the community, the medical community. So they know what's available and what's not. So I think it's, even if they were to charge you for that call, it is a Zoom call you should make it where you really bring all your meds and get the information you need. And I think you can still do that with some physician, not just, that company is no longer, but the physicians are still here. So after I talk about what I'm going to tell you, please continue your due diligence, especially if you have a strong, complicated history, because, and I hate to say it, it may not be the best thing for you to move to a new country based on your medical profile. Now, if you say, I have hypertension and I take medication, I have diabetes, but it's controlled, that is not what I'm talking about. Most of us are going to have some of those things as we go old. The issue is it manageable? Or are you managing it well? We have an ambulance going by. So even when I talk later on about certain plans where we have access to, they want to find out, is your hypertension under control? But anyway, let's get off that soapbox. So I'm saying, my point is, you need to really think hard and make sure the decision for you to move abroad is a well thought out decision and how it affects you as an older person, okay? Because you know what, sis? You are in the best medical position now, because as you age, things are going to get worse. Now, if you're somebody who's maintained a healthy lifestyle, you can delay, things happening, but things will happen. Very few of us just drop dead at 95, having had no issues. Don't think that's how you're going to go. I hope and pray, but the reality is probably not. I'm going to be stricken with some awful disease, and I don't like to speak it into existence. Delete. But it's important. So I want you to think twice, 3 times about your decision to come to Panama if you have a lot of medical issues. If you have your group of physicians, all your specials, everything lined up, and you have to be seen every 2 months, every 3 months, you need this thing done, you need this MRI, this CAT scan, it's going to be complicated. I'm not saying it's impossible. It's going to take you a lot more work and effort to line everything up. We do have a lot of good doctors here, and you can have access to a lot of good medical care. That's not what I'm saying. And also, we are close to Colombia. Colombia is a medical tourism haven because a lot of people go there to have things done. All right. So let's say everything I've said to you, most of it doesn't apply, and you just have some mild things you're dealing with, but you want to know, what can I have access to? What is available in Panama? Before we go any further, I want you to know a little bit about the Panamanian healthcare system. Panama has a public system and a private healthcare system. The public system is really designed for people who don't have a lot of money to have access to care, and the care is cheap. But what's happening in those medical facilities, clinics, hospital, this is a developing country. They don't have unlimited resources. So some of the buildings look kind of old. The care may be basic, but you'll have access. Also, you may have to wait because the public wants to go there because they only spend a little bit of money to be seen. You may have issues with access to specialists, because if you go live in the boonies in the mountain and then you say, I need an orthopedic surgeon to do this to my toe, whatever, you may have to travel to the city to get that done. So these are the kind of things, as an expat, we come in with our expectations of what we have access to over there. even though you may have to wait 3 months to get a mammogram. I went to the US in February and I said, I'd like to schedule a visit. And it was like 3 months out. I would be dead by then. We don't have that issue here. But the public healthcare system in Panama, the public system is financed through taxes that people have paid into, like Social Security. And sometimes you have employer matches, just like we do in the US. So there is the Social Security fund that is referred to as Caja de Seguro Social, right? They use Caja anyway. I'm not go into that, but that's the name of the agency that manages Social Security, pension, disability, but they also manage some public hospitals. The other arm of the public healthcare system in Panama is called MINSA, Ministeria de la Salud. MINSA, M-I-N-S-A, that's an acronym. All right. This is like the health department. They also have hospitals. They also have some polyclinics where people have access to in those smaller communities. They are also involved in public health, like immunization program. If we have an outbreak, just like what your health department would do in the US, that's MINSA. So MINSA, Caja de Seguro Social, together they manage the public health system. Now, remember what I said, there might be long waits. The facilities may not be what you are used to, but they are available even to expats. So this program, the public health system, is really there to assist the people in the country who don't have a lot of money. But you as a foreigner, which is a great thing, you can go in there, you take your seat, you will be seen, and you maybe pay your $1.50 to see your doctor, which is, I mean, the costs are very, very low. I'm happy for them, for the people here to have access and pay $1.50 to see a doctor. Hallelujah. Okay. Now you have the private healthcare system that is available to people who work, people who have a job, who get insurance coverage to their employer. It's still super, super affordable. Now, when you go on IG, Instagram, or they love Instagram here in Panama. So if you're looking to find out a business, don't look for them on Facebook. You'll find them on IG. Now, I don't do TikTok, so I don't know. They might be on TikTok too. But the private healthcare system, I've seen some plans like $30 a month, $50 a month, and they have some Panama, the country sponsored plan that are super affordable to the locals. You, as a foreigner, also, you can have access. The good thing about Panama, it doesn't say, oh, this is just for the resident, therefore you stay over here, you don't have access. I'm very grateful for that, okay? So if you have an employer, you can get insurance to your employer, or if you are a digital nomad or you self-employed, you can tap into that because you are young. A lot of things are age dependent in Panama. Up to age 64, you can have access. And of course, the prices will increase based on your age and also your medical condition. Panama is big on pre-existing conditions. Now, some pre-existing condition, they probably are not going to cover, like cancer and other things. But if you have, let's say, I don't know, you had a blood disorder or something, they might say, oh, because of that, we are not going to cover anything related to that illness for 12 or 24 months. So there is a delay. So until you pay in the system, right? So you have access. So that's what I tell people. If you're in your 50s, do the best you can to sign up with a plan, especially a Panama sponsored plan, because when you hit 65, they're not going to kick you out. You're already in. Don't wait till you're 65 and be running around trying to find insurance. In Panama, it's almost impossible. If you have money, yes, you have access. What happens in In those private hospitals, of course, you have access to physicians, specialists. The public healthcare system does not cover. I read somewhere they don't cover therapy, they don't cover dental, they don't cover this, cover that. Well, yesterday I went to a Caja de Seguro Social group, and they had a big building. It says therapy. So maybe you pay a little bit based on what you can afford, but it is available. So some of the public hospitals, I told you, the polyclinics and the medical, the big hospitals, like the largest public hospital here in Panama is the Santo Tomas Hospital. I don't know how many beds they have. You know how in the US you go, it's an 830 bed hospital, but it's the biggest one, okay? And I've heard some good and not so good reviews about people who've gone and got things done. The thing to remember is that if you have a condition, even if you're older, the public system is not going to discriminate against you in terms of you being admitted. If you say, oh, I need to have this done, I don't have insurance, it's going to cost me $10,000 in a private hospital, but at a public hospital, it's going to be $2,000. Then you can make a decision, okay? So the public hospitals still have specialists, cardiologists and all that, because in Panama, doctors are required to work in both the public and private sector. So the quality of your providers is not so different. You're not going to get just a really poorly educated. And most of your doctors here have studied somewhere besides Panama. They've gone to maybe South America, they went to Brazil, or they went somewhere in Europe, and they went to the US. So a lot of them are bilingual, but that does not apply to the rest of the staff. That's why knowing some Spanish is super important. Okay, so you can have your care in a public hospital even as an expat. The issue you may have, looking at my thing hanging over here, the issue you may have in the public sector, if you live in a community outside of Panama City, is access to specialists. I watch the news every day, and a lot of time they'll say, we haven't had a cardiologist for 3 years at that clinic in Bolonga or wherever that might be. So if you're a cardiac patient and you need to see a cardiologist, you're going to see the general practitioner. But if you have a condition, let's say you have an arrhythmia or whatever, you have to travel to the city to see a specialist. I'm not saying it happens all the time, but there is a possibility because the specialist docs, they want to be in the city, when they have access to people here. So keep that in mind. Another thing that I see happening in the news, in the public sector, the buildings are old. Every so often, they will say the AC goes off inside a whole hospital. Can you imagine that in this heat? So they have fans. Dialysis is a chronic issue. The machines sometimes don't work. People have need to be dialyzed 3 times a week. And if the machines don't work, what happens? You don't get dialyzed and all that stuff builds up in your system, you could die. And is it easy for you to travel? You can't travel to the city 3 times a week to get. You see how it becomes a conundrum, becomes a problem. That's why, sis, if you're 80 years old and you're moving to Panama, but you say, oh, it's too hot in the city, I want to be in the mountain, or I want to be on the beach. Just know that you won't have access to these specialists in those places. The clinic may be 30 minutes away. Do you have a car? Yes, you have a driver, but is the driver going to be available? What happens if you have an emergency? Think what you're doing and be clear on how you prioritize, okay? Yes, you love the mountains, but you're kind of fragile and you're old. I'm just saying, I'm just suggesting, you are your own person. You make your own decision. When I was in Costa Rica, people love to be in the forest, and they have their little cabins and I can hardly see. I don't want that. But some people thrive on that. But with having, living among all the animals that you love, you got to know if you get a snake bite or something bites you, where is your nearest clinic? And is the level of care you're going to receive there what you need at that time? Another thing I tell people is that when you are moving to another country, and I said that in another video, you have to really assess your philosophy of health, life, and longevity. Not only do you need to do your homework and be true to yourself about your medical picture, your health picture, but the what ifs you have to work in your mind. What if I'm on the road and I get into a major accident? What if I'm in Chitre or somewhere 5 hours away from the city and I get into a bad wreck on the Inter-American Highway? There are no helicopters going to come pick you up and take you to a trauma center. And you have to be okay with that because that's what you chose. You choose to come to a place where you don't have access to all these things. And don't go badmouth the country. Oh, I don't understand why they don't have this, they don't that. They just don't. And you're a guest. You should have done your homework before you came over. The country is not going to adjust for you, Miss, Queen, whatever. Okay? All right. I'm going to get off that soapbox. Private healthcare is accessible. Private healthcare is pretty good in Panama. Those of us who are expats here, we can pay out of pocket for a lot of things. People rave about going to see a physician and the physician spending 90 minutes. Did you hear that? 90 minutes taking notes, asking you questions about every system in your body, your history, looking at all your medications. And chances are he's going to take you off some of these meds. All these doctors over there kept giving you pills. They don't do that here. So that's one reason a lot of us are healthier. Well, I haven't been to a doctor and I have to my own confession, but I'm a medical professional, so I know a thing or two. We pay for a visit like that, I don't know, $50, $80. Isn't that worth it for a doctor's time? And having somebody sit and actually listen to you. Do you get that at home? Do you get that where you come from? Okay. So we pay out of pocket for medical visits. We pay to go to the ophthalmologist. We pay to get our glasses. We pay, I don't know any hearing aids, but I'm sure you could get hearing aids. We pay to get our teeth clean. That's why in your budget, you need to have a line for medical expenses. Now, the next question you're going to ask me is, can I use my Medicare in Panama? And the answer is a big no. Please don't ask that question again. Medicare, straight traditional Medicare does not work outside of the US. I don't know if Puerto Rico, because I don't know. But again, I'm only talking about what I know, which is Panama. You cannot use straight Medicare here in Panama or any other major country, right? What you can have that is become an option is you can switch to a Medicare Advantage plan. I finally did the switch this past winter because, they have enrollment between November and December. And I did that after a lot of soul searching, could I, should I? And again, switching to a Medicare HMO for me was because of my mindset saying, I will not go back there to retire and to end up in a nursing home. So that made it a little bit easier. There are people who are so anti that. They're like, oh no, this lady used some kind of derogatory term the other day about, no, Medicare, whatever. Sis, I am not telling you what to do. I'm telling you, I did my homework. I'm a medical professional. I work within the system. I bill Medicare and Medicaid when I had my home care company. I understand how this system works. Okay? For me, because my goal is to live here and die here, going to a Medicare HMO was not that hard a decision. But if you want to keep your Medicare, if you want to go back every year to get your general wellness check done, if you need to go and have regular mammograms and CAT scan or whatever, do use this. But no, you're not going to be covered here under Medicare. Now, Part A, as you know, is for hospitalization. Part B is for your medical visits and also for your durable medical equipment, like if you need a wheelchair, but they don't cover 100%. So the $185 you're paying every month for your Part B, that's what it covers. And many people who are traveling do not pay for the Part B. That is their choice. I'm still paying for my Part B. Also, some people have a Medicare supplement. So whatever the Medicare Part B or the hospitalization doesn't cover, that insurance, Medigap, whatever you want to call it, it kind of covers the gap. But when you come to a country like Panama, some people say, well, I have Medigap, I have Medicare supplement. I understand it will only cover you so many months, maybe 6 months after you move to another country. So it's not a permanent solution. Some people even suggest that if you're going to stay here, but you want to keep your regular Medicare, you could consider travel insurance for emergencies. But I don't know how long you're going to be able to keep that. I'm not an expert in that. That's why I'm going to do a disclaimer right now. All the information I'm giving you, and then I'm going to talk about access to medical insurance after a certain age. You need to talk to an insurance agent to get the latest information and the latest rate. Maggie is not an insurance agent. I'm just telling you my experience with the healthcare system here. Let me get some tea. Hibiscus, mint, green, and lime juice. Okay. Have you liked the video? Give it a thumbs up, share it, and subscribe. Okay. So, no Medicare, Medigap only for a short term. Travel insurance is available. Okay? But if you want to stay here long term, if you're 60 to 64, go talk to an insurance agent and lock into a plan. Now, based on your medical condition, the rates will vary. The older you are, the more complicated your medical situation. There is not like a one base rate for everybody, no. And in Panama, before they write your policy, you're going to have a medical checkup. Based on your age, they're going to do all your vital signs, blood pressure, temperature, blah, blah, blah. If you're a woman, they want to go a mammogram. If you're a man, they're probably going to do a PSA, for your prostate. They may want you to do a colonoscopy. They're going to do an EKG to check your heart. They're not playing. They're not playing, okay? So be ready for that. And then usually they give you a good rate for them doing that, because I think Hospital Santa Fe had told me that they were going to do it for like $90 or something like that to do all those tests. That's amazing. So just know they're going to check you out. And based on the results, they're going to sit down and say, okay, based on her profile and her risk for whatever, this is going to be your rate. You can't discuss that. You can't be upset. I told a sister that it might cost $150 to $200 a month. And she's like, expensive. I'm like, what? You think $200 expensive for your health insurance? Where are you from? Where did you come from? Can you get that over there for that price? Okay. Come on, guys. Panama is not utopia. You're not going to the promised land. You got to learn to work within the system. Okay. So I would say if you're less than 64, do the best you can and get a plan and get locked in so that when you hit that magic 65, you don't get kicked out. Because me at 66, I've gotten kicked out. I can't sign up for a lot of the plans. Some of the policies say 65, no exceptions. The good thing is that they're not all the same. Everybody has like a tier and they have their own policies and differences, okay? After 65, it becomes really, really difficult to get health insurance here in Panama. A lot of the major Panama-sponsored plan will not cover you. They just say to 64, dead end, period. So when you go talk to that insurance agent, you would say, what plans do you have that I can sign on? And he will tell you if he has any. The other thing to remember with these insurance plans, even if you're less than 65, is that pre-existing conditions, like I say, a lot of them will not cover you if you have a history of cancer. But if they say they took the tumor and everything, all the tests you've had afterwards are clean, they might. That's why it's individualized. The decision is an individual decision. It's not the insurance agent making the decision. It's the insurance company. When they sit, they get your application, they get the result of your health check, and then they make a decision, up or down. You could be denied. Don't assume that after going through all that, you will be accepted. Okay? That's that. So pre-existing condition, and also they may decide, oh, okay, she had all this tests done, she had the surgery and everything's good. Let's wait for 24 months and see. After 2 years, if nothing shows up, we'll start paying. But even when we pay, it might be at a lower rate. It might be 70-30. You know what? If you've worked in insurance in the US, you know how it goes. It's not easy. It's not easy. All right. Now for the problem of older people who come here. You 66 like me, keep your Medicare over there if that's what you want. Or consider switching to a Medicare Advantage plan. During the enrollment period that's coming in November, you cannot just decide, oh, I want to sign on in July. It doesn't work that way. You know that. So in November, when it's enrollment, you find an agent who is working with some Medicare Advantage plan in your state. They are state specific. Just make sure you know that. You can go to medicare.gov and it will tell you which insurance companies are in your state. With Medicare HMO, sis, listen, it only covers emergencies. And what is a medical emergency is anything that would require a visit to an urgent care and up. Urgent care, hospital, okay? They're going to pay for that. But most of the time, and up to until really recently, you had to pay first and then submit your claim to the insurance company to get your reimbursement. And it might take a while. You know, the insurance is going to do the little gymnastics they do. Denied, denied, denied. You didn't send me this piece of paper. You didn't send me this, that, trying to not pay you. You know how it works. That's how it works in the US. So you have to be tenacious, and it takes a lot of, you know, and what they want, I believe, is for you to say, oh, so much of a headache. Let me forget it. Let me just pay it. So when you go to private hospitals here in Panama, if you don't have an insurance card with a plan that they work with, you got to give out your credit card for them to pre-bill. They look at your situation, they say, oh, well, she's coming with abdominal pain. It could be gallbladder. We think it might cost, if we needed surgery, $5,000, which is what it costs to have your gallbladder out here, by the way. That's what I heard from a couple of hospitals. And when you get discharged, they itemize everything. If they overcharge you, they would put the difference back on your card. If not, they'll charge you more. That's why If you don't have insurance in Panama, make sure you have a credit card with a nice credit line so they can charge for your care. Because, sis, if you go to a private hospital, they're not obligated to care for you if you can't pay. There is no indigent care here in Panama, okay? 911 only works in Panama City. So if you call 911 and the insurance, the ambulance comes, they'll take you hopefully to the nearest hospital. If you don't have insurance, maybe have them take you to a public hospital if you can speak. Then you're going to sit there on the gurney and wait a long time, things that you're not used to. Well, you should if you go to the US in the emergency room. You know how that works. That's the thing. People come here with all kinds of attitude and expectations, and I'm like, where'd you come from? How does the ER look on the other side? Come on, stop it. You go there and you wait for hours, especially in the winter when it's busy. Stop it. So if you go to a private hospital, chances are they don't usually ask you for money up front. That's the difference in a public hospital. But before you leave, you got to pay, okay? And a lot of times you got to pay cash, even though it's not a lot, but they want to get paid. I don't know what happens if you can't pay. I don't know if I make you do dishes, maybe they make you clean the floor. I don't know. So that's why, as a sister here, you need to have a next of kin, a sister who knows you, so that you say, oh, I'm at Santo Tomas Hospital. I sprained my ankle and the bill is $150. Could you bring me $150? Part of the emergency plan we talked about, having a sister that you trust on your account, or she'd be willing to advance you. She'll go to her bank, get the money, and come and get you out of jail. So you can go home. So you have to prepay. You can ask anyone if they've been to a plan. Oh my God, look at the time. If they've been to a local hospital here, you have to prepay. But I have good news. Up until recently, we had to prepay, but now they realize there's so many older expats coming here. And there is a company that's working with some of the major hospitals in the city and the one in David to bill the Medicare Advantage plan on your behalf so you don't have to flip out a credit card. That's a game changer. So what I recommend you and I do is to pre-register with those hospitals. So yesterday, I got a chance to go look at Pacifica Salud, and I went into the lobby. Frankly, it gave me New York City vibes. It's in a Jewish area, so I saw a lot of Jewish people, but it's one of the best hospitals. So, when you're sick. So that is a game changer for them to do that. But not every hospital does that, okay? We have several private hospitals here. Panama Clinic, Hospital Nacional, Pacifica Salud, which used to be Punta Pacifica, and they have a campus in Costa del Este. The hospital David Chiriqui, I want to say it's private. Apparently, they're building a hospital somewhere in Boquete. I don't know, but the needs are there. The people are here. Lots of people are coming. So, of course, it's supply and demand. Business mindsets get together. So you cannot use your insurance, your Medicare insurance. You can use a Medicare HMO if you choose to do that. Or Medicare Advantage, I hate to say HMO, Medicare Advantage. Okay, what are your other options if you don't want to do that? I told you, if you want to keep your Medicare, regular Medicare, and you want to go back to have things done back and forth, you can consider travel insurance. But if you say, well, it's not just travel insurance, what about it? I just want, people just have a hard time adjusting to their situation They want, they want, they want, they want. Well, you may not get whatever you want. You may not get everything that you want. Okay, sis? And I'm saying this in love. You know that. I'm never saying anything to you to make you feel bad, make you sound stupid. I'm just saying. You have three options. Medicare Advantage plan, if you're over 65, let's qualify that. If you come in here in your 70s, a lot of sisters are coming here. A sister who's 80 just got here. There's a lady in El Congre who's 85 years old. We are coming, but you got to make sure you get some health coverage. Number one is you can have your credit card if you're a woman of means and you can bill whatever, do that. You need to have a line on your budget for those medical visits. You know, if I have a cold, if I need a shot, if I sprain my ankle, whatever. So have some money to go to the doctor. The other thing that you have is you can sign up for an international plan. The Cignas, the Aetnas, the Blue Cross Blue Shield, Worldwide Medical, or whatever they call them. All right? Those plans will cover you everywhere you are in the world. The only thing is, the older you are, the pricier. And most people can't afford that. So, but that's an option. Somebody even said, if you want to keep your medical, let's see, if you want to get one of those worldwide insurance and you have your Medicare in the US, choose a plan and exclude the US. Then your rate is going to be lower because guess what? Everything is more expensive in America. We pay the most for healthcare, yet we do worse among industrial countries, industrialized countries, right? So, number one, Medicare Advantage plan, an option. International plan. Third option is Hospital Santa Fe, which is a small private hospital that has its own plan that is pretty affordable. You will get a medical test done. They will consider covering you from pre-existing condition. They might delay payment. But also, the biggest thing for that plan is that there is no age limit. Even if you were 90 years old, they will take you, but your plan is going to be depending on different factors. So check into Hospital Santa Fe. I think I will put a screenshot. There is a video that Jackie Lang did where the CEO of the hospital was giving you a tour and explain how it works. The only thing I don't like about that plan is that you are limited to that hospital. If you had anything you needed to be done, it had to be done there. And my question is, what if I have an emergency and I can't speak? How do I know to tell you to take me over there? So, you know, logistics, right? And I think if I were going to sign up for a plan like that, I went in there and spoke to some people, but I haven't signed. Because the thing about limiting me to that hospital just doesn't sit well with me. Okay, so that is an option. And the option is to self-fund, okay? So those are your options, okay? Nobody is gonna say, well, there's a sister the other day in our group, she's like, well, if we all get together, maybe some businessmen will create a plan just for us expats. I don't know. And I know things don't move really fast here in Panama, so I'm not gonna hold my breath for that. Personally, I will tell you, I have not signed on. I looked at Hospital Santa Fe and I'm like, I don't know. There is another hospital called San Fernando Hospital that also has a plan that kind of similar, that you have to use their facilities. So right now, I'm covered under my Medicare Advantage plan. My goal for this week and next is to register myself because they have a form online that you can fill out to pre-register, and you put your insurance information in there and they'll check it so that if I were to be admitted there, then they would have my information, okay? I know it's a lot, but I want you to know that insurance does not work the same way, and the older you are, the harder it is in this Panama street, so that you have to decide to make an informed decision, because there is no indigent care. If you get in a hospital, you're gonna have to pay. There's a sister who needed some gallbladder surgery. She's going to a public hospital because she said she couldn't afford the $5,000 that you have to pay to get it done at a public hospital. And she's younger than I, so she can get into a plane. Like I said, get into a plane quick and lock it so you in. Emergency services here in Panama. 911 works here in Panama City. If you decide you love the mountain, you love the beach, ask yourself, where is the nearest hospital? People ask the question all the time. Oh, I love Nueva Gorgona. Yes, but Nueva Gorgona probably has a clinic. I don't know. I know there's a clinic in Coronado, which is about 20, 30 minutes away. This guy, I had posted a question on one of my Facebook pages, and I said, what happened in emergency? And he said he had a business somewhere in the beach areas, and one of his workers, something fell on him and it sliced him and he was bleeding. There was no 911 to call. He said he had to, thank God he remembered to put some pressure, like a tourniquet, and then put him in the car and took him to the nearest clinic. And in here in Panama, this is something that upsets me. They're calling places hospitals that are not really hospitals, they're clinics. You know, like in Volcan, going to the hospital? No, it's a clinic. In Coronado, oh, Coronado Hospital? No, it's a clinic. Okay? If you have a hospital, they need to be able to provide you what you think of as a hospital. There's emergency, they have units, they have doctors, they have specialists. You can get your testing done. That is a hospital. There is another one. I have to say there's a fourth option or fifth option. There's a new thing called mini-med. May not be new, but it's like a membership kind of thing. You pay like $20 a month, and then they have clinics all over the city. I don't know if they're outside of the city. They might be. You can look into that. And then they have a place they call the hospital on Tumba Muerto, J. Alfaro, that big road. And it's like a big emergency room or urgent care. So if I were to have to need to have like a knee replacement, trust me, I wouldn't be going there. That's from a medical person. And their reviews are not that great either. So be sensible, okay? Talk to different people. Talk about their experience. There's a sister here who was admitted to a hospital, Sherry Brooks, I believe her name is, and she was talking about her experience. And the hospital was great, but she said the language barrier was an issue. So learn your Spanish, sign up for my class, okay? You need to be able to understand and tell them what's wrong with you. Oh my God. So 911 emergency works in the here in the city. People have had things to say about the ambulances. Some people say the ambulances are bare. All the major hospitals like Pacifica Salud, which is like probably the creme de la creme here, they have their own ambulance attached to them. And one tip, sisters, older sisters, if everything is wrong with you, you're feeling poorly, it's not an emergency where you pass out, you can't say anything, call your doctor first. Your doctor will give you directions as to who to call, where to go. Your doctor will call a hospital, tell them you're coming in, and you get better care that way. So don't just, it's not like the US when you just say 911 and then they'll take you wherever. Call your doctor first, okay? We even talk about if they find you dead in your apartment, right on your emergency thing, call my doctor. The doctors have carry a lot of weight here. And in the ambulances, and some people say they have private ambulances that you can sign up with, you know, like a membership to say, if anything happens to me, we'll call you and you can come pick me up. They know you and they might be equipped with equipment, like your blood pressure, oxygen and stuff like that. But I'm not even sure you would get ACLS, Advanced Cardiac Life Support. I don't know. I don't know that they have helicopters and pads to come and take you from here to another. But Pacifica Salud is associated with Johns Hopkins Hospital. Hospital of San Fernando is JCO accredited. You guys know they have accreditation. Take those with a grain of salt. It doesn't all mean that everything is great and perfect. Okay? I think it's more of a marketing thing, just to say we are JCO accredited. You know, I'm a nurse, so you know I'm a cynical person. You know I'm a cynic, you know that. All right? So, ladies, gentlemen, I told you it was going to be a long video. There's a lot to unpack in this video. Make sure when you come to Panama, you come in here with your eyes open. My goal is to kind of figure out things like home care, hospice care, palliative care, because we are getting older. And there was a lot to consider when you decide to bring your old body here to a new country. You know, we in the Americas, the culture here is that they take care of their own at home, but you don't have a home here. We're trying to create a community so that we can take care of each other. So let's be in the know. Let's know how the system works and manage your expectation. Okay, some other thing to, in conclusion, to consider if you want to consider coming to Panama. Know your medical history, see how complicated it is, and if it makes sense for you to remove yourself from your healthcare team into a brand new area. Have a consultation with a physician on the ground to see how you're going to be able to manage your care, especially if you have some very expensive medications. You got to know, can I have it here? Some people get meds from Amazon delivered. You can do that too. Some people fly to Colombia to get their medications. You can do that too, okay? Understand the benefit, the pros and cons of keeping your Medicare or transitioning to a Medicare Advantage. It's a personal decision. I'm not going to tell you what to do. You do your due diligence, okay? Find out if your meds are available. In Panama, your regular meds, you don't need a prescription. I can walk into any pharmacy and order blood pressure medication, diabetic, blah, 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 okay? The only medication that need a script are antibiotics and controlled substances. Okay, understand that the system is different and manage your mindset and your expectation that if something major happened to you here, you may not make it and you have to be okay with that. If you want the bells and whistles, I understand that some of the Medicare HMOs, you can always charter one of those flights to take you back if that's what you want. A lot of us here, we have our cremation plans. We don't want to be taken back over there. Manage your expectation and your understanding and your philosophy of life, okay? And my last word is don't hang on to life too tightly because our days are numbered. I know. I sound like the doom and gloom, but I'm not. I'm just very practical, okay? Work out with me, exercise, see Malvina Brown, and get all your gut health and all that good stuff done. Eat well, exercise, sleep, engage, give back, do the best you can, and live and let live, right? Okay, oh my God. That is a long video. I promised you I would give you all the information. So next time somebody said, can I use my Medicare in Panama? Can I get health insurance in Panama? This is required viewing for you. Yes, you can, but, okay? It depends on how much resources you have. Okay, all right, guys, I'm going to stop the video right now. I hope you enjoy this because I've poured everything I know about it. And by the way, a little thing, the life expectancy in Panama is 76.8 years. It went up to 79 years in 2024. And in the US, it's 79 too. Go figure. Why are they the same? Okay, I think that's why a lot of us are here. All right, guys, God loves you. I love you. Au revoir à la prochaine. Bonne journée. Bye bye.